Fantastic. Okay. Hello, welcome to today's meeting of the Health and Social Care Select Committee at the London Borough of Hillingdon. This meeting is being broadcast on the Council's YouTube channel, Hillingdon London. The purpose of this committee is to monitor services provided by health partners in adult social care and review their performance. We also undertake in-depth reviews and witness sessions on specific topics and submit our findings to the decision-making cabinet. My name is Councillor Nick Denys and I'm chair of this committee. Before we start, I have some important housekeeping for everyone present. Please ensure mobile phones are on silent. We're not expecting a fire drill, but if the alarm goes off, please follow Nikki. Please keep your microphones muted when you aren't speaking, then unmute to speak, and as chair, I will call on those to speak during the meeting. Excellent. Okay, so we're going to move on to the agenda now. Do we have any apologies?
Chair, we've had no apologies for absence.
Fantastic. Declarations of interest? Nope. Fantastic. Do we have any comments on the minutes from the 23rd of January? No, yeah. I would just like to say thank you to Nikki for noting what was a very, very, very long meeting and doing a very good job noting a very, very long meeting. And a few of the people here, actually, almost everyone apart from Dr. Sagar was actually at that meeting, which always feels like it's still going on, actually, but it isn't. But anyway, but thank you for doing an excellent job on a very long meeting. Right. Item 4. Everything we're going to talk about tonight is in public. Yes. Correct. Fantastic. So we come on to our main topic for today, which is essentially getting an update on what we've described as our rural communities. So obviously we are a London borough, but at each end of our London borough we have places which have a more sort of rural aspect to them. At the north we have Harefield, which very much feels like a village and is quite surprising to anybody who goes there who might think that that's part of a London borough. And then to the south we have Harefield and the Harefield villages, which...
Heathrow.
Oh, Heathrow, sorry. Heathrow and the Heathrow villages, which again, in one sense, does feel like more of a countryside area, but in the other sense has this massive, 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 massive shadow over it, which is Heathrow Airport, which impacts on it greatly. So the sort of format of today's meeting is we're going to have a presentation from the NHS professionals to talk about the coverage of healthcare provision in those areas and maybe some ideas about where there are weaknesses and how to improve those. Then I'll ask Lisa to talk about her experience and what residents are telling her. So Lisa from Hillingdon Health Watch picks up a lot of information about residents and how they're experiencing health matters, and then we'll go to questions from the committee. So I'm happy to go with whichever way you want to go. So who wants to go first?
I think, Chair, it's me who's drawn the short straw, just in terms of leading off on the presentation. And what I'll do, obviously, is bring my colleagues, excuse me, in to that conversation. I will try and use this. Yeah. I can remember Patricia Wright having the same problem with last month's meeting. If not, I can I can talk to. Don't worry about it. I'll talk to the. And I hope you enjoyed the presentation, colleagues. It went quickly, didn't it?
That'd be the quickest meeting we've ever had. But no.
I'll start, Chair. I will start. So first of all, thank you for inviting us to talk about rural. About rural healthcare in Hillingdon. The focus, Chair, inevitably for us has been around the Heathrow villages as exemplars of the rural issues that are faced by these communities. And really, what I want to preface by saying is the reason why we are focusing on those 5 villages, that these areas face challenges accessing health services because of their geographical location, and the 5 villages that obviously compose of those Heathrow villages. Of all of those villages, only one of them has an in situ GP practice, an in situ pharmacy. Although obviously they are all covered by GP practices from various parts of the locality. And what I want to do is just preface that by and I'm not going to bore you by going through things I've been through before at this meeting, but critical to tackling the issues that are faced by rural communities is the work that we're implementing in terms of neighbourhoods. And the reason why that is important, and this is the slide that we talked about at the last meeting, and I'm not going to go through it in anything you've heard it before. For us, the key to this is to develop local solutions for the big health challenges that we're facing, and that actually the era of trying to drive corporate change for local communities is demonstrably doesn't work. So what we want to try and do is break the health service down into smaller parts. Those smaller parts can then work with their local communities and engage with their residents. And I'm literally, from this evening, Ritu and myself have come from an engagement event with residents, of which some are actually from the Heathrow villages. We're going out to see them again on Monday. And the focus of that is about listening to what matters to them. Yeah, is what matters to them, rather than what Keith Spencer thinks or Ritu Prasad thinks. Is what matters to them. And that's the approach that we've tried to take, which is, to be honest with you, is very unhealth-like in terms of trying to listen to what people have. So our preferred model is to implement integrated neighbourhoods, to have them focus around the local communities, mobilise those local communities, listen to them, and develop those local solutions to the needs that they, and empower them to have that. And in that way, tackle some of the deep-rooted health inequalities that we do have, and we do have deep-rooted health inequalities. And I noted down what one of the people on the webinar said to us, the senior residents, is you need to go to where people are, not try and keep bringing people to you, and is go to where people are and go to those communities and listen to what they have to say. So our solution is to integrate neighbourhoods, is to organise services around neighbourhoods, but to do it in a way where we listen to the needs of those communities. So implementation of this model is critical to our approach, and at the heart of all of these models is general practice. And I've got two general practitioners with me this evening, both of whom, as well as the many hats they have, are clinical directors of neighbourhoods. And again, I'm grateful that Sagar's joined us this evening, who is not only is a local GP, but is the clinical director of the neighbourhoods, one of the clinical directors of neighbourhoods in which the 5 Heathrow villages are located. So Sagar is close to action. So what I just want to do, if I got this right, is talk a little bit about the challenges we faced, what we've tried to do, what we've learned so far, and what people are telling us about what their needs are. And if you excuse the pun, I'm going to do it through the vehicle of the well-being of the well-being bus that we tried with mixed success to put in place. So a number of us around this table went out to meet the residents of the Heathrow villages almost about 6-7 months ago, and asked them what they would like us to do. And what the residents came up with was a sense of, well, the idea of a well-being bus to come out and listen to what residents are saying, and to come up with some solutions based on that to what those residents wanted. And as you can see, we launched that on the 3rd of October for a 12-week pilot. And the bus was used to mobile solution to go round the villages. And in it had a range of services. We were offering vaccinations, some talking therapy services on some days, vaccination teams, and also listening to what people wanted. What we found is that attendance was significantly higher on days when the vaccinations were offered. And there's a clearly need for more vaccination support in there, and I'll come on to that at the end when I talk about what next steps, what do we intend to do with that. And all attendees, we did a survey of all the attendees to look at their health needs, and 88% of those rated their health care as average or above, with 51% rating it as excellent or good. I mean, interestingly, and I'm sure Sagar will happily talk to this, is 66% had visited their GP in the last 6 months, and 50% of them in the last 3 months. Now, the next bullet point, I felt there was a certain irony around that, is that 34% reported they were unable to access the health services they required. And this was actually largest in Hillingdon, which actually has more in situ services than the other villages have. So what's interesting is the presence of those services didn't necessarily mean that they felt they could access those they had access to those services, which is just an interesting lesson, isn't it? Although the issue around GP actually was greater in Harmondsworth than in others. So though Hillingdon, which has an in-situ GP practice and an in-situ pharmacy, felt more the residents there felt that they were able to access the services that they need, which I thought was just an interesting statistic given what we might otherwise believe. The challenges that we encountered in the pilot, and this sorts, and again we'll discuss this with the residents next week. We thought the mobile solution would be a good solution, a good health solution for villages. What we found is that the bus that we had probably wasn't fit for the purpose that it meant. It wasn't appropriate for clinical activity. If you were speaking about your mental health, it was basically an open plan bus, and that's not great if you're wanting to address people's mental health needs. So it was one of those things where actually the desire to do good and ambition didn't match up to the practicality of delivering that. There were limited attendees on some days, and there's an interesting statistic here. There are actually, I think, significant proportion of younger people in those villages who work in other places. So actually, most of the people who attended the bus were people over the age of 65. So what's clear is, in terms of a cohort of people, it was people over the age of 65 who were using that facility. Others were clearly getting their support because they're more mobile from other parts of the community. We're meeting with residents on the 26th of February to discuss the next steps. We have compiled a full evaluation, which I will be very happy to share with the committee once we've shared it with the residents, obviously, and they've had a chance to put input there. So it's a much more detailed evaluation. To put it into context in terms of the health needs of the villages, and is that actually the prevalence rate of obesity within the Heathrow villages. So you will know that the three big challenges for Hillingdon, based on our joint strategic needs assessment, is hypertension, is obesity, and common mental health conditions. They're the three big long-term conditions our residents are facing. And if you look at the Heathrow villages and compare them to the wider population, the prevalence of obesity within Heathrow villages is 9%. That's in line with the Hillingdon average. Prevalence of asthma is 4%, and that's lower than the Hillingdon average. And the prevalence of anxiety, that is also lower than the Hillingdon and North West London average. So just to root it in terms of the needs, in a number of areas, the prevalence are lower than the wider Hillingdon population. That's not to say they're not important, but actually they are lower if you look at the joint strategic needs assessment. So I think the key thing for us is, if I move us on, is there was a particular. Obviously, we did a whole range of deep. The Colne Union PCN is the local neighbourhood, the local PCN, which works with the Heathrow Village, and there's been a whole range of events that have taken place there. And I will invite Ritu and Sega to talk about them, because they're one of many events which neighbourhoods are leading now across the patch. And we talk about this particular event on the 13th of February that took place in the church. And that's a nice picture of John McDonnell in the middle of the in the middle of the slide deck there. So what the next steps are? I just say what's the lessons learned. Now I'm caveating this with, we haven't spoken to the residents about this yet, and they may have a view, and we just want people to be able to implement that. But what we have done, we will roll out integrated neighbourhood team. That is our plan. That is our strategy. The North West London vaccination team have committed to running a series of events in the Heathrow villages in autumn 2024 to local residents. They have their own vaccination bus. I think you probably picked that up by now, and that was a big uptake in terms of those services. We are about to implement something called community champions, and those community champions will work with those local communities to develop service offers around their needs. That is being funded through population health funding that's been made available to us by the North West London ICB. What we also are committing to doing as part of a procurement exercise for some of the GP services that are within that cover the Heathrow villages, what we've built in as part of the specification is to provide regular outreach GP provision to the villages, which I'll be very surprised that GP access has been a key issue. We discussed this at this meeting on a number of occasions, and that's a key plank of what we're wanting to do, as well as what we are wanting to put in place, and we're close to agreement as well, is basically how some of the local pharmacies can extend their support to the villages as well, in terms of vaccinations, in terms of other things, and we are close to agreement on that front. So there are things that are being put in place on a wider level to try and bridge the gaps that we developed. I put that there simply because, again, we want to talk to the residents about that. There are other needs that they may well articulate that we want to be able to do. I'm going to pause there, but I am just going to invite and look at my colleagues as well. There's anything you just want to do just to amplify what Sagar, do you want to?
Yeah, maybe I can just give you a sort of a brief update about what happened on the 13th. Unfortunately, I wasn't there, I was on holiday, but the team from so I'm a GP in Useley, and obviously my PCN covers the area, and so do a lot of my patients there. So this was actually, in the Confederation over the last 3 years or so, we've been doing quite a lot of road shows in the whole borough, and that's basically to try to take health screening and health advice to the communities to see, and a lot of that is information gathering, as well as actually doing health checks, as well as giving advice on medications and etc. And we had one recently, and one of our residents in the Heathrow villages suggested that why don't we try and do a sort of a bespoke one in the villages, because we've never actually done one in the villages. It was quite tricky to find a venue, and I think that's one of the issues that perhaps we came across. We did find a church in Harmonsworth, which we then, and they were very helpful, and we kind of used, but I haven't had, we need to sit down and evaluate this properly, but just early indications was that this perhaps wasn't the best venue, because it's sort of, if anyone knows the area, it's sort of kind of tucked away in the back, and it's not very obvious. We did do quite a lot of comms. Perhaps our comms weren't as good as they ought to be, but the event was successful for the people that came, and they really enjoyed it, and they really got a lot out of it. We had one of our physiotherapists providing lots of advice on frailty and advice on exercises and advice on how you can sort of avoid falls. We had a lot of promotion on smears. We had someone from St. Mark's doing bowel screening, a promotion. We had a bereavement officer there helping people to do that. So it was sort of a varied sort of thing. We had our pharmacists there doing blood pressure checks and sort of doing enhanced NHS health checks, which were really welcomed by the people who were there. We found that there weren't a lot of people, and some of that is, we were thinking about perhaps the timing was not right. Maybe we need to do it later in the evening. Some of the feedback we got was the issue with the villages also is that inter-village transport is poor. So even if you have where we had this, the people from the other villages can't really get there without going into town and out. So I'm not sure how that can be addressed, and whether we need to look at transportation routes for certain things. I mean, this was just the first one, and I think I hope it's the first of many to provide what Keith is talking about, is trying to provide sort of screening and health promotion to people where they live. So that's basically the early feedback from what we provided.
I think probably Keith's covered most things. There's been like you said, there's been a number of events. So obviously we've have put on the bus to kind of gain feedback, and to also put on both vaccinations and support, health support on the bus. But it has been helpful in gaining feedback, and we have had a few. I think we've had at least one event that went into the evening, and I'd agree that maybe the uptake maybe wasn't as we would hope, but we did have a kind of steady trickle of people coming through, which included people coming in after work. So I'm hoping that kind of the information that we've been able to gather is of use, and I think actually the next steps that we have here, which we will talk to the residents about on Monday, just to double check that they match, but they would match with the feedback that we've been getting from both the bus and the events that we put on.
Great, thank you. Before we go to my comments and the committee's questions, Lisa, can you give us some thoughts about some of the feedback you've received about our rural areas?
Certainly, thank you, Chair. Okay, so I'll start with Heathrow Villages because obviously when we're talking about GP access, that can mean a lot of different things to different people, and I'm glad that you've picked up on the transport issues within the villages. So what residents have reported to me is certainly around the lack of primary care services in the villages, with the closest GP practices and pharmacies tending to be in West Drayton and Hillingdon or Heathrow Airport, all of which are sort of not within reasonable walking distance for many of the residents, particularly if you're looking at sort of Harmondsworth Village. And for residents without their own transport, to access a GP or pharmacist in Harlington or Hayes can mean a really long bus journey, sometimes with sort of 2 bus changes to be able to get there. So my understanding from the residents I've spoken to is that they feel very strongly that there's a lack of investment in the area, and that's likely due to the ongoing threat of the third runway, and that they generally feel quite forgotten by services. We're aware, I'm aware of the recent conversations that have been held with by Hillingdon Health and Care leaders with residents that have resulted in the roadshows and obviously the wellbeing bus pilot. However, I think resident feedback sort of highlights that there needs to be a more permanent solution to improve access that's consistent, and I think it's the consistency here that's key. So that clearly requires some further thinking around some innovative solutions within the primary care network, such as regular outreach at different times of the day, sort of feeding into the enhanced access hubs. Just very quickly moving on, because I do want to bring Harefield into this as well, which obviously has slightly different issues, I think, but certainly the impact of transport infrastructure affects that area. So there's one GP practice in Harefield who obviously covers the Harefield ward. Now, under the NHS's choice framework, patients have a right to choose their GP practice, but this can be quite problematic for the residents in Harefield, especially where we found there's cases where maybe there's been a dispute between the GP and the patient that can't be resolved, and the patient's left feeling as if there's nowhere else for them to go. So, for example, if you're a resident in Uxbridge, you've probably got a choice of about 2 or 3 local GPs, and this isn't the case in Harefield. And whilst the primary care network in the north of the borough covers the Harefield area, and whilst geographically that might make sense, the public transport infrastructure makes it very challenging for some Harefield residents to access another surgery in the north of the borough, and even the integrated neighbourhood hubs. So it's a lot easier for residents to access Uxbridge if they're reliant on public transport. However, those practices in Uxbridge are probably more likely to refuse registration because those residents sit with outside their catchment areas, and quite rightly for reasons that if people are in need of urgent care, they can't get there, and the practices maybe can't get to them. So this reduces patient choice of access in the Harefield area. I think also what we've seen or what we've been hearing is that the issues with regards to travelling to access primary care have recently been exacerbated by ULEZ, with some residents in these areas raising concerns with us around the potential cost of accessing primary care due to the need to drive, especially when public transport is not a great alternative, or it's not an option for some, especially those that care for people that maybe have mobility issues and can't use public transport and get there themselves. So that's a very quick summary of what we've been hearing in those areas.
No, thank you. That's a very good summary, actually, of things that we've been hearing as well. I actually went down to Heathrow Villages to Harmondsworth yesterday to speak to a couple of residents, and it's certainly the forgotten about bit certainly comes across, and I think there's a combination of forgotten about, but also, to be blunt, the feeling that everyone else has given up on them. So no one invested in a post office because the post office won't want to invest in the land. Don't have a swimming pool, that's shut down, and all that sort of stuff. And then they feel like because people don't invest, maybe that's part of the problem of finding a venue. That they're sort of being left in this limbo where what's going to happen with the third runway, and and it's a terrible place to be, or Harmondsworth is a very nice place to be, but the feeling within that was quite bleak at times. I've got a couple of questions. I've got loads of questions, but I'll just do a couple, then I'll open up to everyone else. One of the questions I had actually when I read this presentation, the second bullet point about the Heathrow bus, where you talk about the vaccine significantly higher, and this is recognised, and bringing the roving vaccination team is a good idea, of course, but surely it must have been really obvious that vaccinations are going to be a problem down there in Heathrow villages, because no pharmacy down there was able to give vaccines. So it was good that this feedback was got from the bus, but I find it surprising that nobody is thinking actually Heathrow villages, possibly the same for Harefield as well, is in a certain situation. So actually we need to think proactively before we learn those things. So I just want to, I suppose my challenge to all of you who are sitting there is, what do you know and how can you be active in order to sort of get in front of people going, oh, we don't know, we haven't got any vaccines, oh yes, we can bring a roving team in. I would hope that we could be more active thinking about the challenges these areas face and what we can do about it. So I throw this challenge to my NHS colleagues. Well, not my colleagues really, though. My NHS friends, should I say? But partners. That's it. Partners. That's the language of the NHS, isn't it? But so how can we be more proactive on the obvious stuff?
No, I think you have a point there, and it would be interesting to see how many of them have been vaccinated by the surgeries that they have been registered with, because obviously there are targets that we all have to meet as GPs, proactive, and especially with children, you have to meet the very, very sort of tight dates that you have to give the vaccinations to. So it's something that we can look at, but if that's the case, then that's something we learn from, and we have provision going forward as well. And I'm sure surgeries that are covering that have that in place. Now with these community events, I mean, the roving teams came about when COVID happened, and that's when when GP surgeries or hadn't coordinated the vaccination, we did the vaccination hubs over here, but the roving teams were mainly meant for housebound patients, and that's what they were able to cover. So, but if there is a need, I think housebound patients are still being covered by them, and they were offering flu vaccinations as well this time round. And we, at a lot of our community events, we had called the roving team in just to attract people, because we are aware that people are not getting vaccinated because of vaccination fatigue at the moment. They just do not want to know about vaccination, but we still are promoting that. But it's something that we will really look into, and then we can come up with some ideas as to how we go out and give the vaccinations. I think in some of the community events, I know about Harefield, that they have used the local church over there to do the mass vaccinations, especially flu clinics. They've done that on a joint basis, and that's worked quite well. And that's something maybe in Heathrow villages and Harmondsworth we could consider doing a flu campaign in those areas as well. And you can take pneumonia vaccines and flu vaccines and COVID vaccines at the same time.
That's good on vaccines, but my challenge is, I was using vaccines as an example. My challenge is a broader challenge. I noticed on the last slide, you talk about developing community champions, for example, and I think, really what I'm trying to get at is Heathrow villages and Harefield have specific issues that need specific thinking about before things are even delivered. So, for example, where I live in Eastcote, when I had my COVID vaccine, I had, possibly 10 different pharmacies within 5 miles I could travel to quite easily. I booked the one which was most convenient to me, absolutely fine. The system worked really well for me, but it would be obvious that it wouldn't really work well in Heathrow villages or Harefield. So while your answer on the vaccines is very good. I want to use it as a broader example of, can we get some more proactive thinking in these areas to deal with those challenges before we get told there's a problem?
So I'm going to violently agree with you, Chair, on that one. You're absolutely right in the sense that we have to be more proactive than we are. And I'll just go back to my very first opening comment, is the bus got going because Vanessa had the gumption to go, and Armel, to go and make it happen. But Vanessa is the managing director of Central and North West London's team in Hillingdon. The reasons why we want to have integrated neighbourhoods is that they should be closer to that. They should be those proactive interventions are critical. You're absolutely right. You know, we should be more proactive, and the reason why we need to make the changes we're making is we recognise the need to do that, and it needs creative, innovative solutions from people who know those communities that they work in. So I put my hand up and say, absolutely right, that's a fair cop, you know, and we do need to be better at that. And you're right, it's a wider range of issues. You're right, the vaccination is just one issue, isn't it? There are other issues that we just need to get better at, and that's why we need to make the changes that we've already outlined.
And my second question, which is sort of related to this, is what I'd really like to see is an actual plan, and this actual plan has an analysis of the actual problem. So obviously we're here because we've got feedback about issues that are happening in these areas, and isolation that's happening in these areas, from individual residents and from the great work that Hillingdon Health Watch does. But I want to know in more detail what is the real problem here. What is the, you said obesity isn't a problem, all this sort of stuff, and that's fine. But obviously, what is the real nature of this problem? Is it very isolated to a certain group of people who need specific help? Is it a wider problem? When you talk about the 34% who didn't access their health provisions, didn't know how to, was it in a specific area? I mean, I want to, ideally, I want to understand really better what is the actual problem, and then start getting in some evidence to show we're actually doing stuff in these areas to make them better. Or if we can't make them better, I don't know, dentistry and hairfield, for example, at least we've identified what it is. And so I suppose, is there any ambition to come up with a more sort of detailed plan which expresses the problems in a way that we can actually pinpoint and then work towards improving?
So I think you're absolutely right, Chair, and I think when you see the evaluation report, it is an in-depth report which goes into root cause, what we think what the issues are for those rural areas, and it's quite difficult for people like me to hold off coming up with the solutions. But what we're holding off on until we've spoken to the residents on Monday is then what will come out of that is a detailed action plan. But what we've tried to do is look at the underlying evidence, look at the data, what it's telling us about the health needs of those populations, and then put together an action plan which we think meets those needs. But again, what residents are asking us to do is to talk to them before coming up with these solutions and ask them what matters to them. So I have to say, a number of us around the table have to restrain our natural reaction to fix the problem rather than just to check with people that the solutions we're coming up with are what they want. So I think there is a detailed report, and once our colleagues have seen it, we're very happy to share it and share with the action plan that will come out of it. But there's just one area. There are other neighbourhoods with their different challenges.
Of course, and that is if you. So before I bring you in, Lisa, I just want to say, on the bus, might come back to it later depending on what other people ask, but I do definitely commend the effort to do it, to think about it, to listen and try and do something. I know it didn't work in the complete picture, but I think that is a good way forward, and I completely understand about the listening point. Lisa.
Thank you. It's a suggestion, actually. Because I think with the development of integrated neighbourhoods, there's a lot of opportunities actually to really understand the people within those neighbourhoods, and I think that perhaps it's not just a case of looking at the health needs, but it's looking at the wider socio-economic needs, and particularly when we're talking about access. And as I said before, there's lots of different strands to that, such as the transport. So not necessarily looking at the geographic area, but looking at the infrastructure within that area, but also looking at the population needs in terms of what their access issues might be, which then might sort of provide a bit of a steer in terms of how services need to be delivered. Thank you.
Great, no thanks, good idea. Right, I'm going to go to the rest of the committee now, so June.
Thank you, Chair. I think the residents in Heathrow villages is a hard fought for what you provide for them. Not adequate, but what you have provided, and I'm sure Armel will eat my head off if I don't mention her name. But she did fought hard, and she fought very hard at different levels, trying to get some kind of services within Heathrow villages. And this has been ongoing for many years. It's not something new that's come up. This is many years. Residents come, residents go. It's been having lack of facilities where health is concerned. So it's a start that you've done what you've done. And it's a start to, as well, to know that you said you looking at areas where you want to develop and look into how provision is provided. But how did you go about doing that in the first place? How many residents did you notify about it? Were the residents leafleted to be aware that this is what's coming so that you can get a more in-depth details of their views and their feelings? The activists within the areas, the ones who actually brought it to attention. But I don't think it was wide enough for residents to be able to access what it is you've planned to do regarding the bus. And the bus itself, I think it was a good idea, but the facilities on the bus was not adequate enough to do what needs to be done. The location, in regards to identifying the location, I don't think enough work went around that to enable people to know that the bus is here, because it was some of the bus location was in isolated areas. So that's some of the concerns that came back from residents in regards to that. And some of the specifics you want to embed within the community and look to see what it is that they want. Vaccination is fine. Yeah. Checks on identifying diabetes and checking blood pressure, so it's fine. But what is going to be provided for diagnostic needs? How are you going to achieve that with what you're doing? And you rightly highlighted that Dr. Suraj, you rightly highlighted facilities within the area to have these open conversations is lacking, and transportation as well is a hindrance. But because the village is spread out, it's not a close-knit area. It's 5 villages around there, and it's spread out. Because I'm sure you left out Longford, but Longford is part of the village, and it's the other side. So yes, it's hard for us to accept and understand how you're going to progress. But obviously our residents will not let you sit, especially Armel, not doing anything. So I'm pleased to hear that. One of the things that I am concerned about in the development of the community champion is how are you going to achieve this with the community champion? Because from the attendance list you gave, the people who attended was over 65. How are you going to target the young people? So if you're going to roll out something like that, you'll have to look at timing and how you do it. Maybe in the morning, maybe in the evening. That will have to be to accommodate the younger generation to actually know that there's something there for them, instead of they having to end up in A&E if something happened. There's no facilities for them. And then to sign up to a GP as well, that's lacking, because the traveling, the area that they have to travel to access GP services. The other thing is mail shots. That's another way of engaging with residents, because if you can mail shot residents to let them know this is what is coming in the vicinity, this is what we're planning to do, this is how we're looking to make sure that your health access is covered, how you can get health access, how you can be signposted. If you do a mail shot to residents, at least, you know, you try to cover each area, but just put in the bus with word of mouth is not good enough for the residents around there. So that is some of the points I want to raise. And also one more point, how many residents are speaking compared to the population? So how many residents are you speaking to compared to the population that we have in the borough?
Thanks, Junior. Keith?
So if I can pick a couple of those points, Councillor Nelson, and then maybe colleagues will join in. So there's always lessons that we can learn, and I think where we come from, you're absolutely right. This hasn't just happened. You know, this has been going on for a number of years, and we recognise the challenges that the villages face, and we recognise that they have a legitimate case. In terms of what they've been saying, in terms of connecting with the communities, I think, Vanessa, we leafleted around 1,000 homes in the area. Was that the right vehicle and medium? We can always learn from that. Is that the right way to connect with those communities? Again, we need. Hope we'll get some feedback on that on Monday. And I think there's the community champions piece. I think the point what we're wanting to make there is that you need people of the community to engage with the community, and the feedback that we got this evening, ironically, is you're absolutely right. The risk is we do end up talking to the same group of people, and the question is that we were challenged with this evening was how are you going to connect with the people who you haven't spoken to, how do you know, and what's the best means of connecting with those groups of people? I think that's something we really do have to work hard on. Because the point we made this evening is that in a digital world, not everybody communicates in a digital way. It's not the only way to do that. So I think there are lessons that we can learn, but the point I guess I'm trying to make is rather than an NHS professionals trying to second guess what the best way of those is, the only way we can do this is by speaking to the communities that are there and find out the best way of mobilising that that community. And the reason why community champions are so important, and if Professor Goodman was here this evening, he would wax lyrical about community champions probably for about 2 hours. Is the evidence base for them is that because they're of the community, they work with the community, and and the evidence that they have of raising levels of health is fantastic. So, and again, they're not health professionals. They are people who live and work in the community, and that's one of our major planks in terms of mobilising that community. And James, who works with Lisa and myself, is leading on that piece of work.
I just wondered if Dr. Sakharov, do you want to come in? I mean, because obviously, first of all, you've come to visit us, so I definitely want you to talk to us, and thank you for coming to visit us. But also, because obviously you have a number of patients in the area, so I'm sure you must have a really interesting view on the challenges, and because obviously you must have experienced and seen some of them yourselves. I mean, in terms of the debate we've been having so far, I mean, what would you like to sort of add to what we've been talking about?
So I guess in addition to all this, I think one of the key things I want to bring up actually is the transportation. That's what most patients, because once they get into, because my practice is in Newsley, for example, once they get into that high street, actually they've got access to pretty much everything. It's getting there is a problem. For us also, doing home visits is actually very difficult. A countless number of parking tickets I've had on doing home visits because there's nowhere to park. And actually, just as an anecdote, I spent 2 days on this Heathrow bus, and both those days, some of the staff got tickets because actually the bus at Bark that everywhere else is double yellow line. So it's kind of like it's a really difficult thing. So even if we do a roving bus or a roving pharmacy, we do need to think about, okay, so how will we do it? We need to find a car park somewhere that we can accommodate people, that people can then come and go to, rather than, so it's that kind of stuff. But I think that's probably, from my point of view, one of the access getting to the high street. If we can somehow manage that, the other thing I think probably from my own thing would work is some sort of roving pharmacy, because GP provision is there, and we could, and I think it's quite expensive for what we provide. But if you had a roving community pharmacist that can do quite a lot of the things that GP can do, one of the issues we have is, so for example, if I want to do a repeat prescription for someone in the village, they have to come to Usually or Tesco or wherever to get their medicine. They've got nowhere to get their medicine, right? So you either have one pharmacy in every village, which probably is a bit impractical, but one of the things that we can think about is how can a roving pharmacy bus or a roving, because of the issues of space, and there not being sort of a high street or a, maybe, on a Monday it's here, on a Tuesday it's there, and they happily deliver the medicines to the local population, something like that. And that's what I think we need to think about, innovative ways of how we can change. But that's, I guess, from our point of view.
Thank you, that was really useful. Interesting. Philip.
So it is. So it is now. I shall pay a hefty fine for that, no doubt, but never mind. This reminds me a little bit of COVID, in as much as we've been talking about it for a very, very long time without seeing very much in terms of tangible improvement, quite frankly. I can remember talking about this on the Health and Wellbeing Board when it was under my chairmanship, and I gave that up to Jane Palmer just over 4 years ago. From memory, in those days, we were talking about problems in the Heathrow Villages area being related principally to the lack of estates, lack of opportunities for GP practices to set up, and the lack of clinicians, personnel to staff those and provide those services. From memory, that's how I've understood it. What I'm understanding from the discussion tonight is we've more or less come to a landing that recognises that the way the area works geographically, that's going to be difficult with these villages. And it now needs to be much more of an outreach approach of the talk we're talking about. So I suppose my question is, have we given up on the estates bit, or is that still fundamentally what we need to deal with to actually deliver integrated neighbourhood working? Or are we saying, well, actually, no, there's an alternative solution, subject to dialogue with residents, that we can take forward in a way that will deliver the outcomes we're looking for? I'm just interested in where we've come to on that debate, please. I do have another question, but I'll leave it there for now. Thank you.
Who wants to take the question on have we given up on the estates? We do even know really what estates are available as well in the area that we can use.
I don't think we have given up on the estates issue, and in fact, I'll tell you, one of my personal missions is to break through the estate issue that we, because it's become a bit of a brick wall for us, as Philip you've outlined. So we've not given up on the estate issue. My personal view, and it is a personal view, it's not the relative, is that actually finding a fixed site would be in the best interests of delivering those services for all the reasons that we found with the bus, which is privacy, confidentiality, and those sort of things. Things like pharmacy, as Sagar said, would work in a much more mobile way. That can be delivered. There are good examples of that in other parts of the country. So we haven't given up on that. I think a fixed solution is better if we can find that particularly if we're going to be running outreach, general practice. Those sort of things really do require a fixed site. But again, that's one of the things I want us to look at. And we're doing a lot of work on estate at the moment from a health point of view. Ironically, working with the local authority, with the council.
Would the airports be able to provide a fixed estate? Because obviously, the issues in Heathrow Villages specifically are to do with the difficult for anybody to take a permanent investment decision in the area because of the airport. Now, obviously, the airport is a massive money maker, and actually I know has been buying up lots of land in the area anyway. I mean, do we speak to the airport about that? Because, you know, it's one thing that they might be able to do is provide a decent abode which could be used, let's say, even for on a short-term lease of 5-6 years, and they wouldn't mind that. I don't know. Just throwing it out there. Are we speaking to the airport at all about this?
I think one of our borough clinical leads, who's the long-term condition lead, has been trying, and we've tried, believe me, with Heathrow. It's very difficult to get anything in there. And all we were proposing is to just go and do health checks for the workers over there. And I think he struggled. There's been a bit of a breakthrough, so hopefully if something comes out of it, we'll be able to tell you. But it's not easy to get into Heathrow or their the areas that they've got. And he's been trying really desperately hard.
I think the other thing is, again, if I just reflect back on conversation we had with the residents of the villages, is, for example, there is a landside chemist on Heathrow. But what the residents are saying to us, that's okay if you work, you know, at Heathrow. The same transport issues apply if you are in the village. You can't get access to and one of the comments they found the most unhelpful was being told at some point, well, why don't you just go to Heathrow for your pharmacy? They didn't find that helpful at all because of the transport issues. So I think it's just understanding that dynamic. I think is quite important, because the populations, what you see in the report, the data is interesting because. Sorry, the particular issue that we found, it's for the cohort of people over the age of 65 who maybe are not as mobile from a transport point of view, who are finding most difficulty accessing those services.
I mean, I was sort of making more the point about the land that Heathrow owns in the villages itself, rather. Obviously, that's still a very important point. I mean, just very quickly, Philip, you can have your second question in a second, but on the pharmacy within Heathrow, if I wasn't feeling well, I don't know if I'd want to go into an international airport anyway, but also I assume, or I've heard, it's stocked up for things that tourists might need. So if you want malaria tablets, probably is a good place to go, but doesn't do flu vaccines, for example. But anyway, Philip, your second question.
It's on this time. Great. Bearing in mind our role in this committee, among other things, is to minimise health inequalities. I'm wondering what measures you have in place to ensure there are equitable access to primary care services for residents, and the extent to which you're able to assess outcomes for them in this challenging set of circumstances, to at least give us a handle on the journey we've got to make in terms of improvements. Because I do agree with you, Nick, we do need a robust plan. You know how much I like tangible outcomes from these meetings, and once you have spoken to residents on how you're planning to take this forward, it'd be good to understand that. So that's my question and just an observation. Thank you.
Pick up that. So what we've done in the evaluation report, Philip, is we've looked at the specific needs of each of the villages in terms of what their health needs are, the challenges that the residents find in terms of addressing their health, and it does vary between the villages. So what we're trying to do, because that's the whole point of the work we're doing on population health, is that we tailor the intervention to the specific needs of that village. And again, what's interesting is, as you'll see from the data, is the perceived difference from residents of Harlington, for example, compared to Harmondsworth. There's a very different views in terms of what their needs are, and in terms of what is important to them, but also the ethnic background and so on and so forth of each of those groups. So we've done a lot of work in assessing that and what those needs are, which hopefully you will see in the report.
Okay, thank you. We look forward to seeing that. Rita.
Thank you, Chair. I think we've touched on some of the questions I'm going to ask briefly. Just coming back to something the Chair said, we've got 34% reported they were unable to access the health services required. Do we know what specific services that they required? And then, ultimately, who's responsible for providing that service? So I don't think we've been clear enough on what they actually require, please.
So what I might just do is try and take this. So in the bottom right-hand corner of the slide of the slide there, and I should have mentioned this in the presentation, so apologies, Councillor, for not mentioning that then, is that words diagram, which I'm always impressed with the technology that develops this. Basically, is what each of the villagers assessed as the particular needs that they had, which they felt they couldn't be met at the moment. So the bigger the word, the more widespread was the need. Now you can see from that is GP appointments, blood pressure, dental services, and general support and signposting to the right services, were the biggest areas of deficit that actually the residents were saying to us they found most difficult to, followed up by the vaccination, and the point that was Councillor Denys was making earlier around, shouldn't that have been obvious to you, vaccination, and then some mental health advice and referral. So they're the sort of areas that people have said are the needs that they've got and that they want us to try and provide more local services for them to do. And in the paper we quantify that, and it's a detailed breakdown of the data. Broadly, they're the areas of deficit that they identified, or their needs.
Vanessa.
Sorry, just to add, in terms of the, sorry, I just had have the report as well. So in terms of the villages where people felt that they didn't have access to those particular areas, were mainly Harlington, Sipson and Harmondsworth were the kind of highest percentages where residents were saying they couldn't access those particular services.
I'd like to come back to the responsibility point that Rita made, because I think that's a very, who is responsible that people get the health service that we as a society judge that people should get. So you obviously got the stuff down here, which is useful in the word cloud on the bus. But who is responsible for making sure that health coverage is adequate within Heathrow villages or Harefield?
So ultimately, the ICB is responsible for those services. They are the statutory body responsible for delivering those services.
Excellent, thank you. Rita, do you have any other questions?
Part the ICB. Sorry, Chair, I'll park the ICB for now.
Always a good idea. Cecil, thank you.
Thank you, Chair. I just wanted, I've got a couple of points, but just firstly, I just wanted to pick up on something that Lisa said in this, because it's about the clarification and definition of access. I think that we have had different people talking about different points of access, and that's going to be a roadmap, I think, in a little bit for you guys, because the challenges are great when you've got different communities, and then you've got different demographics, then you've got language access, and then you've got age, and you've got nationalities, but you've then got working, non-working, socio-economic, all these other things that come into this. And then you've got the idea that somebody who is unwell has to go into a car park, into a bus, or into something that is not permanent to go and seek care or seek help. And whilst I'm not knocking all the efforts that have made, because I think they were absolutely brilliant, I really, I champion those kind of things, but I just feel that when there is no presence of a GP service, that we have to think about what it is like for the patients who are going in there, rather than just going, right, well, they need that, so we're going to put that over there, and we're going to do that over there, and we're going to do that over there, because it doesn't make, I don't know, sense to me as a human going, if I was ill, and I just wondered whether something like what we have done in Ruislip and other areas, which is the overflow hubs, if there are any kind of opportunities for something like that to happen. So if people can't get to Useley to your surgery, that they can get appointments in some kind of overflow hubs. I don't know, I'm just asking a question, and maybe transport again becomes an issue in this as well. But yeah.
Should we go, if you've got a second you can come back with another question, but should we go with that one, because that's a good point.
So the question of setting up these hubs is obviously, one is estates. In Hillingdon, we have no large estates, and we've been working with the ICB on the estate strategy, and believe me, and the council is helping us, because we have no big estates and we have to borrow rooms here and rooms there. And to set up a service like the same-day urgent care, you need clinical space which is CQC approved, and that requires investment, and which is what we're struggling with over here, because their funding is very, very tight. And even if you have to go out and set, because permanence is another word that came up, so it's like if you need permanent sort of resource, that which is clinical space, that's a resourcing, and that's what we're working with the ICB, and we're working locally to find solutions and how we are able to fund these, because they're not cheap facilities to develop and to maintain, and that's what we're working on. But it's a big challenge, and that's why setting up a same-day urgent hub in that area could be a very, it may, I mean, I'm not sure about what estate is there, and that's what the council is showing us, the map of various estates they have in different areas, and then you would have to put in a service. If there was something, you could rotate it, but then you've got to think of the same-day urgent care hub has to serve a neighborhood, and how would the other residents, because it has to be equitable for everyone. So these are the challenges, and it's not an easy thing. If there was an easy fix, we would do it, but that's what we are facing at the moment. But it's not because of not wanting to do it, we are trying our level best.
Just come in a second, because I was thinking about the super hubs, because obviously we talked about it previously and you had it on your slide just there. I mean, how does a super hub in Ruislip help Harefield, and how does a super hub in Hayes help Heathrow Villages? I like the idea of super hubs and stuff, but I mean, just for specifically what we're talking about tonight, or does it at all?
I mean, the super hubs are there to house the neighborhood teams. It's not saying that all services are going to be delivered from there. Services can be delivered at like a hub and spoke. It's just to co-locate various partners so that we could start working as a team to look after patients. So that's the purpose of the hubs, not to deliver all the services there, but just co-locate a lot of our healthcare organization, our voluntary sector, community services all in one place. And also to develop teams that work across with different capabilities, hospital teams, like we're trying to integrate therapies so it becomes a more efficient vehicle of delivery of care, with the hospital, with community services, with primary care physiotherapists, just to get them all together. So that's the purpose of these hubs. It's not just to deliver care, and that's why the hub and spoke model is what we would be proposing to do, and that's why some of them may be physical sites, some of them may have to resort to mobile units, and that's something we'll have to look at.
Cecile, do you have any more questions?
Chair, so just kind of just recapping on the part, I appreciate the challenge. My God, you know, it is a challenge. I can see it. I get what you guys are having to go through. And in terms of development of housing estates and not having any of those kind of infrastructures put in place you know, I find that that healthcare has almost become elitist in this case, which I don't buy into. But one of the things, you know, I don't know if estates you mean porter cabins, if it's just land you're talking about, or if estates mean buildings, or what do you mean by estates, one thing. But I'm also going to ask another question here, is this can't be, do we go and look at best practices in other rural communities across the country? Because this is not something that is just prevalent to Hillingdon, because this must be happening across rural countrysides across our communities. So how do we get best practices of what other communities are doing, especially marginalised communities across the UK, as NHS and ICBs and all this can possibly link together to kind of bring that best practice and bring it to Hillingdon, so that we can go, actually, that worked over there, that didn't work over there, and kind of somehow put together a plan, as the Chair has kind of requested.
Yeah. So we do that. I mean, I've spent lots of parts of my career working in Cambridgeshire and in Lincolnshire, which are some of the most rural, compared to those, you can drive for 2 hours to do 30 mile, and not see another soul, and then there'd be remote villages. So what we tried to do in developing the model of care and developing the approach here is to bring the best of practice, but always bear in mind you've got to apply it in a local context. You've always got to take account of that local context. So that's what we are doing. We are looking at that. I have to say, much of North West London looks to us in terms of innovation, in terms of what they're doing. But we do look. I can assure you, we do look at other models, and what we try to do is build the approach that we propose on those models. I think, which is we're not afraid. We steal with pride. We're not afraid to take other people's ideas and apply them.
Thank you. Adam.
Thank you, Chair. I had a couple of questions. But before I get to them, the first thing I wanted to pick on was transport. And I'm pleased that Councillor Punja mentioned rural, because there are probably, and I doubt they're watching because they've probably got better things to do, but there are probably thousands of people around the country who actually live in a rural area that would listen to this and feel that these villages are not rural. I did some research before. There's a very frequent bus service that goes through Sipson. There's 2 very frequent bus services that go through Harmondsworth. There's 3 very frequent bus services that go through Longford, and 4 very frequent bus services that go through Harlington. And I say that not to discredit the feedback of the people who live in those areas, but there are actually people who live in parts of Charville or parts of Yedding or parts of Ickenham or Ruislip, or even some parts of Uxbridge, particularly if you live on the sort of moor area, that don't have the level of public transport access that people in these areas do. And actually, therefore, is this more a broader question around how people in Hillingdon are satisfied with healthcare rather than specific to these areas? I'll get on to the questions. So the first one was, has there ever been a GP surgery or a pharmacy in Harlington, Sipson, Longford or Harmondsworth? And if so, sort of how long is it since the last service was there?
I'm not sure which area, but there was a single-handed GP practice in one of the villages who passed away in 2010, something like that. And that list was sort of, it was quite a small list of 1,500 people, I think, and that was just dissipated, and one of the practices in West Drayton took over that list.
So one village had one GP, but the other 3 potentially have not for some time. I'm just curious.
Harlington has a GP practice.
Yes. Okay. So Harlington does, but out of the others, there's not. I'm just curious as to why this is a problem now, as opposed to something. We've been speaking around. There's been mention of the 3rd runway at Heathrow is partly to blame for this challenge, but actually, some of the villages don't have a GP practice or haven't for 14 years. The second question was just around, because I think it's very good that you're listening to what people want and trying to deliver based on their feedback, and you said it is around what people want, we will deliver. What's the sample size of the people you're speaking to relative to the population of those villages? It's just to get an idea of, are we only hearing feedback from people who are very angry or from people who are very engaged relative to the people who might be quite happy, or to the people that just don't feel comfortable reaching out or haven't been contacted?
I can start on this. So, it's a really good set of questions, so let me try and answer. So, in terms of this survey, I think there are 136 people who completed the survey. Is that a representative sample of local communities? Probably not. I would say it's better than what we've normally engaged with in terms of making service changes. But I think the challenge we got this evening on the webinar that we had from residents was you need to engage with a wider cohort. You need if you want to do this, you're going to need to do more than a webinar on a Wednesday evening with 16 people on it. You are going to need to find different ways of engaging. So I think it's a really good point. We need to get to that place. The other point you make is what is interesting. I think the point I made at the start of the presentation is that the residents who were most dissatisfied were the ones who had the GP surgery in situ within within their practice in terms of their access to services. So just having one, you're right, doesn't necessarily make you say, yeah, everything's great here. It depends on the intervention too. So I think that at the end of the day, it's not about wants, it is about needs. And because actually I want many things, but do I need them is another issue. So I think we have to balance. We do have to balance all of that. And the final point is just around scale. Is there are some inevitabilities around health at the moment, and Sagar's just, if we look at the trends in GP practice over the last 20, 30 years, we are, and health service generally, we are now moving to more things done at scale, so fewer and bigger is where it's moving, and that's because of workforce issues, economies of scale. All of those things are happening now, which are changing the nature of how we deliver care. What's incumbent on us, isn't it, is not to disempower, disenfranchise and marginalise people because they live in rural communities in doing that, which is why the hub and spoke model that Ritu's talked about, I think, is quite important. But they are really interesting questions, Councillor, and I think they're things that we discuss all the time in trying to get a balance, because what we can't be in a place is whoever shouts loudest gets that. We have to balance that against the need, which is why the data Councillor Denys referred to, I think, is quite important as well.
Thank you. Yeah, no, I mention it just because if you were to survey everyone else in Hillingdon about how happy they were with need and want and access, you may find that it's actually not dissimilar in terms of what their thoughts are. Just one final point before I go back to you, Chair. I think it is appalling that NHS staff are being given tickets when they're doing house calls, and particularly with the bus and staff working on the bus, which was kind of a joint trial. We have to find some way that these hard-working people are exempt from a penalty charge notice for carrying out and doing their job. And maybe that is part of the solution, actually, in terms of this area.
Well, also those who want to attend the bus shouldn't have to worry about that as well. So I think, and also, to be honest, that's in the council's power. So I think that's definitely a learning point that I think we'd support having a more proactive look at in terms of permits and other things. June, did you want to talk a bit more about sort of the legacy of these issues? Because obviously you've been a councillor in the area for a long time.
I just want to comment about in regards around the GP service that's provided in the area. I was elected in 2010 and I have never seen a GP service in the area. There is one in Hammondsworth, but there's none in Cranford Cross, there is none in Simpson, and there is none in Longford and Hammondsworth. And that's how long that the residents have been fighting to get the GP service. And Heathrow was mentioned. I was out of the room at the time where why can you not link with Heathrow? But the GP service in Heathrow is not solely for the public, it's more for the business side of things there, and those who pay, because it's a paid service as well. So we cannot link that for residents with Heathrow GP service. We only have one pharmacy, and that pharmacy is in Hillingdon. There's no pharmacy around, so if anyone wants to access pharmacy, they have to go out and travel to West Drayton or travel to Hayes or travel, more out to Uxbridge. So, yes, there is no GP provision that has been around.
Thank you very much. So I've got Philip wants to come back in. I want Tony wants to come in first time, and then I'll summarise at the end of that because we're coming towards 8 o'clock. So, Philip.
Yeah, on the subject of buildings that we've been talking about, I'll look at Nikki and this will make her smile, but I know that certainly Councillor Riley, during the course of the last council, was chairing a committee that was looking at opportunities that may exist for public buildings, be they Hillingdon or other public buildings, that might help meet some of the need that we're talking about this evening. Now, I asked you about it on a couple of occasions subsequently. Did that ever see the light of day? Has it died a death? Is it something we could still look at in the context of this discussion? Thank you.
Chair, I believe that as part of the Health and Wellbeing Board discussions, the Chief Executive was actually working with, or somebody within the Council on the Chief Executive's direction has been working with Keith and others to identify any estate that we have within that area.
Okay, thank you. Right.
So something hopefully is going to happen,
Yeah,
and
okay.
when it does, we'd like to hear about it. Excellent. Tony?
Thank you, Chair. I was going to ask a question about the Super Hub, and I think you've answered that. I'll be very brief. I commend the work that's been done so far, and I think you've got to buy people in. If you just do a one-off, it's all right to do a one-off in November or whatever, but you've got to buy people in. They want a regular service, a regular update. But there's also the stuff on the property. There's lots of 106 money floating around Heathrow, around the works being done. That could be, it's down to the planners to negotiate. But a planning gain for a GP facility or something would be ideal out of 106. I know it was tried at the St George's Park, is it called? The RAF Uxbridge site. St Andrews, sorry. St Andrews, and that fell through, which was very unfortunate and was very upsetting. And we're seeing the aftermath of that in Uxbridge now. But it doesn't mean that we can't go back and try and get some gains from some of these 106s that are floating around, especially around some of the big developments that are going on around the airport.
So before I ask for comments on that, Cicel was actually making a point to me earlier about, about estates and how that can be looked at. So I'm not going to steal your thunder, but do you want to make the points that you were sort of thinking about?
Sure. Thank you. Listen, you know your jobs. I'm just literally putting out, brainstorming ideas here because, one of them might be gold dust and they might not be anything. But, things like hotels, supermarkets, cinemas, I'm sure you've thought of all these, but just places that already exist that may have capacity for things like blood pressure clinics, for just looking at all these bits and pieces like vaccination supports, maybe especially mental health services that have got a space in there. And I only say this because I was sent to a physio in a climbing wall area, in a clinic, in the climbing wall centre in Harrow.
I can see why physio might get a lot of work though, especially in the climbing wall clinic.
Yeah. But it's just that there's a person who's rented out a space 2 days a week in that climbing wall area, and it's a professional space. It's there and it's available. So I'm just I know you're looking away from corporate partnerships in this case here, but when a community isn't needed, maybe we do need to look at those kind of things, is all I'm going to say.
Yeah. I think that's a good idea. So, just generally about estates, obviously Tony made the point about 106 money and and estates, and then obviously Cecil's coming with some interesting ideas about using spaces there. You're right. You might not need one space. You might need a space over here would be good for blood pressure. Space over here would be good for X, and then you need to figure out the transport around that, as well, which you point in. But yeah. So, any sort of thoughts on this?
I'll let Richard come in and talk about what we're using and things, but just what I can assure the committee on is we are working incredibly closely with the local authority around the state, more closely now than we've ever worked, and working intensely on 2 or 3 key sites, of which I can't say any more. But we are working really closely, really flexibly at whatever accommodation we can use. And you're absolutely right. We're not afraid of thinking out of the box in terms of using former shops, cinemas, you name it. We are thinking out of the box on that, and working really closely with the council on what the art of the possible is to try and break this logjam. In fact, I think Vanessa and I probably spent half of our week thinking about estate at the moment, because we think it's such an enabler. It's such an important enabler in terms of all of this stuff. So, Richard, do you want to talk about some of the innovative things we've done, and just in terms of?
Yeah. So, talking about supermarkets, no, we as PCNs and neighbourhoods, we have gone out. Asda was really kind. We went and did blood pressure checks, about 350, and it was great because it's in the middle. Asda was the only one who did offer us just the corridors to sit in, but other Other supermarkets are a bit reticent because of their health and safety regulation, but Asda was really good. So it is something that you can go out and do and come as a community event, definitely. And we've done it, and we're carrying on doing things. And similarly, using faith, certain religious halls and things like that, that's ongoing, and that's a community event. Getting back to your estates, we are working really very closely with Tony Zaman, who's really helping us with this, and we are trying to, and because of our relationship that we built up during COVID, because we had to set up hubs and vaccination sites, and the council helped us because we got no big estates. So we've used the Ruislip Youth Club, we've used Winston Churchill, we had the Navnat Centre, and you name it, we have moved around everywhere. And Mead House is one of the council's property actually, where we got our South Hub for a while. So it's not like, and I think that has been a breakthrough, and I hope, fingers crossed, that we'll get these hubs finally.
I would just throw out one other idea to you as I pass it over to Nick. Sorry, I'm brainstorming today. Sponsored shuttle buses for transport issues. There's massive businesses in around Heathrow and around that, just in terms of the businesses that are around that area, and their logos on sponsored shuttle buses to be able to kind of roam around, so it kind of moves away from the public transport. Maybe it's pick up appointments on this, I don't know, I'm just thinking outside of the box.
Yeah, I mean, obviously messages on the side of NHS buses always have been very effective in the past, haven't they? So right, I'm going to draw the conversation to a close right there. Obviously, any other ideas? Keith loves ideas, so if you have any, do send them through. I'm just going to sum up the meeting just before we leave. Firstly, thank you very much for coming along and talking to us about this really important issue. Really appreciate it. We talked about some really interesting things: transport, estates, and I think estates in general might be something we come back to in the future. Of course, that sounds very interesting. I think for me, what's really important is this more detailed plan, this better understanding of what the need is to bring on Adam's point. Where is it specific to the ruralness of those areas, or is it a Hillingdon-wide thing? What is the plan? How are we going to show that we're improving this? Obviously, thinking and concern this area is a lot more focused on Heathrow than Harefield, and that's natural because of the issues faced by Heathrow. But hopefully, by getting to grips with those and maybe improving those, we can think about how to deliver better in Harefield as well. And next time we talk about this, I want to concentrate a bit more on Harefield. So, I think we want to see more about what's going to happen and how it's going to be improved. So, I think that's everything for now. So thank you for coming and giving evidence on this, and we look forward to hearing more in the future. You're free to leave. Thank you. Thank you. Right, so the rest of the agenda is actually quite short, which is very nice and appreciated. We've got the Cabinet Forward Plan. Does anybody have any comments on the Cabinet Forward Plan? No? Okay, fantastic. And then we come on to our work programme. Councillor Palmer and Sandra have confirmed, haven't they, for our next meeting to come and face questions. So at our next meeting, they're going to come along, talk about what's happened over the last year, what they've learned, and what's going to be happening over the next year, especially to do with social care, and there'll be our opportunity to ask some questions about that. So that's the next meeting.
And we've also put the autism on there as well.
And we've put the autism report on there as well. Fantastic. We've agreed to move the April meeting to the 22nd of May, so everyone can put that in their diaries. And then that's it, isn't it? Because then we're into the new council year. So, does anybody have any comments on the work programme for now?
I'll bring cake.
Okay, but I might not be.
Oh.
Is the club opposite shut, or we can't go there? Okay. Well, I apologise for that. If you send a substitute, it's completely welcome to send a substitute on that night. And congratulations as well. Okay, cool. Okay, so is that everyone happy with that? Fantastic. Is that the meeting closed?
Yep, that's everything.
Meeting closed. Thanks, everyone.